Hi, I'm Stacy Davidson. I'm the Quality Director for Rush Foundation Hospital. I'd like to welcome you for being part of our team. Today I'm going to talk to you a little about accreditation for Rush Foundation Hospital, quality and patient safety. Welcome to New Employee Orientation. I'm Stacy Davidson. If you need to contact me, you can reach me by email at stacy.davidson@rushhealth.com, stacey.davidson, Davidson, @rushhealth.com, or you may contact me via phone at 601-703-3023. Today we're going to start off talking about accreditation bodies. Being in hospital, there are certain regulatory agencies that we work with. One is CMS. That's your Centers for Medicare and Medicaid Services. Also, we are accredited by DNV GL Healthcare, better known as Det Norske Veritas. DNV has some guidelines that we follow, which are the same as the conditions of participation from CMS. We call them the NIHO, National Integrated Accreditation for Healthcare Organizations. And we're also ISO certified, which is a certification from the International Organization for Standardization. Why is this important? This is showing that Rush is working with the regulatory agencies to make sure that we are on task with those rules and regulations that are required of us. The Centers for Medicare and Medicaid Services, they develop the rules and regulations or standards for healthcare facilities to operate under. These rules and regulations are known as the conditions of participation. Sometimes you may hear your manager or director speak about COPs, not cops as in the police, but COPs as conditions of participation related to CMS. As I mentioned, we are accredited by Det Norske Veritas, DNV GL Healthcare. They're the accrediting body that Rush Foundation Hospital utilizes. DNV uses the National Integrated Accreditation for Healthcare Organizations, NIHO, to survey our facility. DNV does accreditation annually at Rush Foundation Hospital. They do not come every 3 years like some regulatory agencies do. So every year we will have an unannounced visit from DNV. DNV's regulatory guidelines are known as NIHO. They mimic the CMS conditions of participation. So NIHO are the standards that DNV GL uses to survey us. Some people want to know, what is NIHO? Interpretation, please. NIHO is what we do. The International Organization of Standardization, you may hear people say ISO, is also an industry standard. You'll see these in a lot of manufacturers. It's process-driven. Right now, Rush Foundation Hospital is currently in the process of transitioning from ISO 9001-2008 series to the new ISO 9001-2015 standards. Interpret. ISO is how we do what we do. What does ISO look like? This is teamwork, consistency, framework, infrastructure, processes, standardization, centered, and ISO is equal. We're all equal in what we do. What is the quality management system? Part of accreditation requirements is that we have a quality management system, and we're fortunate at Rush Foundation Hospital to have one of those. It's a management system of quality. We put focus on processes and work instructions. It's a great foundation for building processes. We measure, monitor, and analyze with the goals of prevention, corrective action, and follow-up as necessary. This slide right here is a little confusing when you first look at it. The very first time I saw it, I had no idea what I was looking at. But the column on the left, let's just act as if that's the door that the patients are entering Rush Foundation Hospital. The column on the right, that's the exit door. All of the material in the middle, all these rectangles and arrows in the middle, these are all the processes. These are all the services that we offer. So in a quality management system, we're needing to know, A, what the patient needs from us when they get here, and the exit. Did we do a good job? Are they better than when they first came here? So quality management system is looking at that overall care in our processes for our patients. Being DNV accredited and also ISO, there are certain documents that we were required to have under the 2008 standards. We have a quality manual, control of document policy, control of records policy, internal audit policy, non-conforming products, corrective action, and preventive action. All of these are located in Compliance 360. You may have already heard about this program for looking at your documents and your policies. If you're unsure, please get with your manager so they can review this with you. When you're looking at your policies, you're going to go to the Rush intranet that should be located on most computers within Rush Foundation Hospital. On the right side of the screen, you will see where it says Compliance 360. You will click on that option, and it will bring you to a search, much like if you do with any other search engine on the internet. For this one, I typed in the word quality. And when I did, at the bottom of the page, you can see some of those different policies that have that word in there. So whatever you're looking for, you just type that word in the search engine under the keyword to find that policy. There are many safety goals that we have at Rush Hospital. What I'm going to cover today is not all of them, it's just a few that I've chosen. Safety goals are here to expand, to provide an environment that ensures the safety of all individuals. This includes, but not limited to, all departments, all contracted workers. Safety is a 24/7 job for consistency. We're here to promote a culture which is proactive and non-punitive, facilitate the reporting of hazards, errors, near misses, concerns, and otherwise unsafe conditions in the hospital. Safety is everyone's job, not just one or two individuals, and it's every day, 24 hours a day, 7 days a week. Safety does not sleep. Patient safety program exists to evaluate and improve processes that enhance our patient safety, educate and involve staff in patient safety processes, and identify events and opportunities that allow for process review and improvement. One of the initiatives that is big in healthcare is fall safety. At Rush Foundation Hospital, we have policies and procedures in place to help prevent falls within our facilities. If you see spills, clean them up. Don't wait on someone to do it. If you see it and you can safely clean it up, please do so. Keep walkways free from clutter and trip hazards. Educate patients and their families on fall risk and hazards. Round frequently on patients, offering them the opportunity to go to the restroom. Have their call bell in reach and educate the patient how to use it. Evaluate the need for assistive devices, such as canes or walkers. Have them close by to that patient. Don't have them across the room. If it's a cane or another device that they need, make sure it's safely within their reach. Non-skid socks are provided at Rush Foundation Hospital for those patients that need them. Keep the bed in low position and the wheels locked. One way that we identify high fall risk patients at Rush Foundation Hospital is a yellow armband that will be placed on them once they're identified at risk for falls. Also, you may see a yellow magnet outside the patient's door with falling stars on there. That's to alert any staff that's entering that room that that patient is at risk for falling. Falls can lead to serious injury and or death. Play your part on maintaining a safe environment for all. Another safety feature that's very important that all of us participate in is patient identification. Correct patient identification is crucial to patient safety. I can't say that enough to you. If you have any contact with patients, starting from the admission process, we have to make sure that we get these patients identified correctly on the forefront. The two patient identifiers that we use at Rush Foundation Hospital is the patient's name and their date of birth. Please make sure that you verify this information and have the patient or the family verify back to you that it is correct. It is important that they're properly identified from the first moment they enter our system. Medication safety. Though this may not apply to everyone, it is important to know that we're all taught the 5 basic rights of medication administration. Right patient, the right medication, the right dose, the right route, and the right time. At Rush Foundation Hospital, we have a risk manager. Her name is Mary Lee Red. She is the one that works with you with their or near misses, never events, if root cause analysis or corrective action plans need to be incorporated. A near miss is an unplanned event that did not result in injury, illness, or damage. However, it has the potential to do so. So let's say, for example, what could be a near miss? I'm going to use something that's outside of the hospital realm. I'm driving to work one morning and I realize that I'm speeding. And there's a police officer sitting on the side of the road taking radar. Well, I know he's there. I pass him. I'm still speeding. He didn't give me a ticket. That's a near miss. I almost got a ticket that day. But I can promise you, if I continue with that same process, that near miss is going to turn into an event. I'm going to end up with a ticket. So in the hospital, if something keeps happening as a near miss, eventually it could lead to a major issue for us, such as a never event. And a never event is any anticipated event in a healthcare setting resulting in death or serious physical or psychological injury to a person or persons not related to the natural course of the patient's illness. A root cause analysis. This is a process that we utilize for basic causal factors that underlie variation in performance, including the occurrence of a possible occurrence of a never event. So if there is an issue that occurs, maybe a medication was administered late, and we continue to see that issue, it becomes a trend, we may decide to do a root cause analysis to see if we can figure out what is actually contributing to that happening. Once that's identified, then we may put a corrective action plan in place. And that's a plan that's developed in regards to an event. The goal is to review the current processes, practices, and develop an improvement strategy to prevent reoccurrence. If you have an event that occurs while you're at work, you need to enter it into our EQMS system. Some of the examples that you might want to enter could be a medication error or an adverse event, such as a wrong medicine, the wrong time, the wrong route or dose, maybe the wrong patient, hopefully not, omitted doses, reaction to medication, or any time you use a reversal agent on a patient. Hospital-acquired conditions. If a patient was to be in our facility and develops a blood clot or a pulmonary embolus after surgery, or maybe gets a pressure injury, which we used to call pressure ulcers, or surgical site infection, accidental puncture or laceration, central line infections, or urinary tract infection after a Foley, we need to enter those also in the EQMS system. Anytime there's a patient code that is also entered, falls, IV infiltrates. This list is not all-inclusive, but it's just some examples of what you may need to enter into the EQMS system. Always get with your manager if you're unsure if something needs to be entered within the system or not. This slide here is showing you how to access the EQMS system. You'll log into the Rush Internet, and to the right you'll see the internal link, and then you'll pick the QMS related to which facility you work in, regardless if it's Rush Foundation Hospital, if it's specialty, or one of the critical access hospitals. You would just click on the drop-down menu and pick which facility it occurred in. Then you'll see on this next slide the online incident reporting. This is an example of what you'll see on the screen. You want to complete all of the information. I would encourage you to print a copy before you hit submit, and then give that copy to your manager. Since Rush Foundation Hospital accepts Medicare and Medicaid patients, there are some programs under CMS that we have to participate in. One of them is called value-based purchasing. This is a program that's part of the Medicare payment system to reward providers for quality of care. Payments are adjusted based on quality care delivered. So gone are the days that hospitals are reimbursed based on volume. Everything is about the quality of the care that you give to your patients. Under value-based purchasing, there's 4 different categories in the quality domain. It's clinical care, which is your outcomes and processes, patient and caregiver-centered experience of care. We'll talk about this in a minute. That's also known as HCAHPS. Safety and efficiency and cost reduction. Under the clinical care processes for your value-based purchasing, currently we're looking at AMI 7A, which is heart attack patients given fibrolytic medication within 30 minutes of arrival. IMM2, which are patients assessed and given influenza vaccination, and PC01, Percent of mothers whose deliveries were scheduled too early, 1 to 2 weeks early, when not medically necessary. Under the clinical care outcomes, they're looking at acute myocardial infarction, 30-day mortality, heart failure, 30-day mortality, and pneumonia, 30-day mortality. Now, a lot of those measures I just discussed doesn't touch everyone, but HCAHPS does. Regardless if you give care at the bedside, HCAHPS is all of us. It's the experience from the beginning to the end for the patient and their family. HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. HCAHPS is a program under Center for Medicare and Medicaid Services. This program is also part of the value-based purchasing program under CMS, which can directly affect reimbursement. When we're looking at the HCAHPS, there are several different categories: communication with doctors, communication with nurses, responsiveness of hospital staff, pain management, communication about medications, discharge information, cleanliness of the hospital environment, quietness of the hospital environment, transition of care, overall rating of the hospital, and likelihood of recommending the hospital. If you'll notice on the slide, there are certain measures that have an asterisk, and those are the ones that are associated with the value-based purchasing program, which does affect payment. Every employee, again, is responsible for the customer experience. Value-based purchasing program includes several safety indicators. They're known as the AHRQ PSI 90 patient safety for selected indicators. You'll see them listed: pressure ulcer rate, pneumothorax after procedure, CLABSI, which is also central venous related bloodstream infection, post-op hip fracture, perioperative pulmonary embolism or deep vein thrombosis. Some people know that as a DVT or a PE. Post-op sepsis, post-op wound healing rate, that's a wound that opens after surgery, or an accidental puncture or laceration rate. They're also looking at catheter-associated urinary tract infections, central venous related bloodstream infections, Clostridium difficile infection, methicillin-resistant Staphylococcus aureus, and surgical site infections for both colon and abdominal hysterectomies. The value-based purchasing efficiency and cost reduction domain, that category has to do with Medicare spending per beneficiary. You may see it listed as MSPB. Another program under CMS is the Hospital Readmission Program. You may hear your manager talk about the HRRP program. These Medicare patients readmitted within the hospital as an inpatient within 30 days of the following conditions, regardless if the readmission is related to the first index visit. So, of these 6, heart failure, acute myocardial infarction, chronic obstructive pulmonary disease, pneumonia, elective total hip or knee replacement, or coronary artery bypass graft. If these patients are Medicare recipients and they come into your hospital with one of these diagnoses and they are readmitted for any reason as an inpatient within 30 days, then this will fall under a penalty within the hospital readmission program. There is an error on your slide, and I apologize. The acute myocardial infection should be acute myocardial infarction. Sorry about that. See, we're all human. Another component of the programs are known as HACs or HAIs, which are hospital-acquired conditions, hospital-acquired infections. There's 2 domains under this program. You will notice that some of the information I'm discussing in this program may also be in another one. So there can be multiple conditions and multiple different programs that you can receive penalties under. So for HACs, Domain 1 from the Agency for Healthcare Research and Quality, AHRQ, Patient Safety Indicator, PSI 90 Composite, you can see that they're listed: pressure ulcer rate, the pneumothorax after procedure, in-hospital fall with the hip fracture rate, perioperative hemorrhage or hematoma rate, post-operative acute kidney injury requiring dialysis rate, post-operative respiratory failure rate, perioperative pulmonary embolism or deep vein thrombosis rate, post-operative sepsis rate, post-operative wound healing rate, and unrecognized abdominopelvic accidental puncture laceration rate. Those that have a double asterisk, those are new measures starting for fiscal year 2018 under the penalty program. The second domain from the Centers for Disease Control and Prevention, the CDC National Healthcare Safety Network, NHSN, Healthcare Associated Infections measures, are the CLABSIs. Those are those central line infections, as we mentioned earlier. CALDIs, those are those bladder infections related to patients that had Foley catheters, surgical site infection with colons, surgical site infections with abdominal hysterectomies, MRSA, and C. diff. Those are infections. What can I do as an employee to make a difference? There's a lot of things that we can do as employees to make a difference. We need to adopt our quality management system. Realize that you play an important role in the prevention of hazards and near misses. Promptly report incidents. Partner in our safety initiatives. Know your quality objectives. High quality of patient care, safety, financial improvement, education, patient satisfaction. Our goal is to provide high-quality medical care with financial improvement to the hospital by a hospital-wide commitment to excellence in service management. Which direction will you take? Are you going towards success or to failure? I encourage you all to succeed in making it safe for our patients. Thank you for listening to my presentation today. I'm thankful that you chose Rush to be your employer. Remember, our motto is being our brother's keeper, and it takes all of us to do that. Thank you.